everybody, it's a great day here at Goldson Spine. I'm here with the patient, Mr. Michael, and I want to say thank you to Michael first because the whole goals for these videos is to get out information about what we do as chiropractors, what we do as physical therapists, and how we essentially help patients who are having various types of pain because of various types of conditions. So anytime we have a patient, we want to say thank you because they're sharing their information, they're sharing their health information, and they're sharing their time actually, because Michael came here today to get treated, and he was all for sharing the information because what he's dealing with, he wants to make sure that other people that are out there that are dealing with the same thing can know how to get relief from it. So today we're dealing with a patient who has degenerative disc disease or degenerative joint disease. It's DDD or DJD. It's almost the same thing when you're looking at it from a orthopedic or chiropractic standpoint. Another name for it is arthritis. So I don't like to overly use the term arthritis because most people hear arthritis and they don't really understand it, and it can sound like it's doom and gloom. But ultimately, the most common type of arthritis is osteoarthritis, and what that means is just wear and tear. So we have all these joints across our body. There's 206 bones in our body. Those bones connect to other bones, and a lot of times when we have wear and tear due to gravity or previous injury or just heredity, that these joints start to degenerate and they start to wear down. The cartilage in between those joints start to wear down, and then we start to have problems. We'll go over Michael's x-rays later, but ultimately Michael came in because he's having a history of low back pain, chronic history of low back pain. And what chronic means is it's just been there for a long time. And there's enough people out there with low back pain that know what I mean when I'm talking about chronic history of low back pain. You wake up, you're stiff. You go to bed or you try to lift something, it's uncomfortable. Like Michael, who's a very strong man, he's found a way to live with it and to work with it without it really stopping him too much, but still he's here because there's some discomfort associated with it. Agreed? So what do we do when we have degenerative joint disease, degenerative disc disease, or osteoarthritis? There's a couple things the medical model does, and you can't fault it. It's medication, of course. You want to have pills to cover up the pain. Hey Mike, did you ever take pain pills?
Yeah,
you did? What kind of medication did you take?
Advil.
Advil? Took a lead. Did Advil help much?
No, I don't really.
It didn't really help much. Hey, what's up?
I was thinking of Alexi too, Rodriguez this morning.
No problem. We were right in the middle of one, but no problem. No problem. That's Marianne. So say hi to Marianne. Come on, say hi then. That's the office manager here. She's amazing. So he was taking Advil, and most people are taking over-the-counter pain meds, anti-inflammatories, something just to help take the edge off the pain. And if you're dealing with the low back pain, you know what I'm talking about. If you haven't had it before, you don't want to wish it on anybody because you can live with it, but it's nagging and it's aching. So you take this pain pill just so that you can get through the day and you continue to work and do what you need to do. The problem with taking prolonged pain medicine is this. There's side effects to this stuff. This little pill can make a huge impact on pain and discomfort and inflammation, but also can make a huge impact on your gut lining. It deteriorates the lining of your stomach, which makes you more susceptible for ulcers. That's the side effect primarily. So we're trying to avoid using prolonged medication because of the side effects. So another option is going to be, can I help you up for a second? I'm going to have you lay on your stomach, okay? So far right now, we're stretching, but we'll get into that in a second. Go on your stomach for me. Another thing is they'll probably give you pain medication. Outside of pain medication, they'll give you pain injections. I'm sorry. So cortisone injections. So when you hear the word cortisone, it's usually it's a steroid. There's different types of steroids. There's an anabolic steroid that most people are familiar with sports. The one that you assume that athletes like Barry Bonds was on. Assumed. But those are anabolic steroids that build you up. Now there's catabolic steroids that breaks things down, and that's usually what the pain injections are, like cortisone. You give an injection to the area that has high inflammation. That cortisone shrinks down inflammation basically, and I'm oversimplifying it of course, but it shrinks down the inflammation, and then you have less pain. You can have 3 of those in one given area, at least the last time I checked. The reason you can't continue to have it because as it shrinks that inflammation down, it's making the structures a little weaker. So if we have low back pain, we have a cortisone injection, the ligaments, there's some other soft tissue around that area, we can shrink down the inflammation, but the structures become weaker, and it becomes too weak, it can't do its job. Lastly, medically, DJD or severe arthritic changes, you can have surgery. So you can have disc replacements, you can shave off a disc, you can have partial disc taken out, you can have a whole area of the spine fused together. Those are options. These days, most people don't want to take medication, and they definitely don't want to have surgery. I'm not opposed to all, depending on the circumstance of the situation. I've seen patients who have had surgery and do very well. I've seen patients who have injections and have no relief, or have surgery and have nothing else happen because you're really cutting into a structure that you still have to rehab. I'm a chiropractor and I'm a physical therapist. I'm looking at the least invasive way to treat. We're dealing with degeneration right down in here. This is where most of our discomfort is coming from, and it's spinal. The spine has started to deteriorate, and you'll see on the x-rays later it started to rotate. So what we're trying to do is to make sure that we support the area of the spine. Stretch. We started off with stretching. Why is that important? Because as the spine starts to become arthritic or become affected by arthritis, the muscles around it become stiff. That's where some of the pain and discomfort comes from. So we have to incorporate stretching with the muscles around that. We also have to incorporate strengthening for the abdominal muscles if it's the low back, and the glute muscles because that supports our low back. And we have support of the low back, that deterioration can slow down and can ultimately be halted. Are we expecting all the degeneration to go away? Not necessarily.